Welcome back. Today we've got 20 brand new NCLEX questions to test your skills and boost your confidence. Grab your notes and let's dive in. A nurse is caring for a patient who is recovering from abdominal surgery and has a nasogastric NG tube in place. The nurse notices that the NG tube is not draining and the patient has increased abdominal distension. What is the nurse's priority action? A. Irrigate the NG tube with sterile water. B. Position the patient in a semi-Fowler's position. C. Notify the healthcare provider immediately. D. Document the findings and continue monitoring the patient. The correct answer is A. Irrigate the NG tube with sterile water. Rationale for correct answer. If the NG tube is not draining, the nurse should first attempt to irrigate the tube with sterile water to ensure it is patent. Rationale for incorrect answers. B. Position the patient in a semi-Fowler's position. Positioning may help with drainage, but the first step should be to assess tube patency by irrigating it. C. Notify the healthcare provider immediately. Notification may be necessary if the tube remains blocked or if other complications arise, but irrigation should be the first step. D. Document the findings and continue monitoring the patient. While documentation is essential, immediate action to clear the NG tube is necessary. CliniqueRN Test Day Tip. Always assess the patency of NG tubes and other drains before taking further actions. Promptly clear blockages to prevent complications like bowel distension. Question 2. A nurse is caring for a patient who is receiving a blood transfusion. The patient begins to experience chills, fever, and back pain. What is the nurse's priority intervention? A. Stop the transfusion immediately and notify the healthcare provider. B. Administer acetaminophen to reduce the fever. C. Slow the rate of the transfusion and continue monitoring the patient. D. Start an intravenous saline drip to flush the blood out. The correct answer is A. Stop the transfusion immediately and notify the healthcare provider. Rationale for correct answer. The patient is experiencing signs of a blood transfusion reaction. The priority is to stop the transfusion immediately to prevent further complications and notify the healthcare provider. Rationale for incorrect answers. B. Administer acetaminophen to reduce the fever. This may help with symptoms, but stopping the transfusion should be the first priority. C. Slow the rate of the transfusion and continue monitoring the patient. Slowing the transfusion will not address the underlying reaction, which requires stopping the transfusion. D. Start an intravenous saline drip to flush the blood out. Flushing out the blood is not the appropriate response in the case of a transfusion reaction. Stopping the transfusion is critical. CliniqueRN Test Day Tip. Always monitor for signs of transfusion reactions. If any signs appear, stop the transfusion immediately and ensure that the proper protocol is followed for patient safety. Question 3. A nurse is caring for a patient with a history of chronic obstructive pulmonary disease, COPD. The patient is receiving oxygen via nasal cannula at 3 liters per minute. The nurse notes that the patient is increasingly short of breath and using accessory muscles to breathe. What is the nurse's priority action? A. Increase the oxygen flow rate to 5 liters per minute. B. Administer a bronchodilator as prescribed. C. Encourage the patient to use pursed lip breathing. D. Assess the patient's lung sounds and oxygen saturation. The correct answer is B. Administer a bronchodilator as prescribed. Rationale for correct answer. In COPD, the first priority when a patient is short of breath is to relieve airway constriction with a bronchodilator. Rationale for incorrect answers. A. Increase the oxygen flow rate to 5 liters per minute. Increasing oxygen without addressing airway constriction may not improve the patient's condition. C. Encourage the patient to use pursed lip breathing. While helpful, pursed lip breathing alone is not sufficient to address airway constriction in this case. D. Assess the patient's lung sounds and oxygen saturation. While monitoring lung sounds and oxygen saturation is important, the priority is administering a bronchodilator. CliniqueRN Test Day Tip. In patients with COPD, always prioritize bronchodilator administration for shortness of breath. Supplemental oxygen should be used cautiously to avoid CO2 retention. Question 4. A nurse is preparing to administer an oral dose of levothyroxine to a patient with hypothyroidism. What should the nurse instruct the patient to do? A. Take the medication with food to reduce stomach upset. B. Take the medication at bedtime to promote absorption. C. Take the medication in the morning on an empty stomach. D. Skip the medication if experiencing any signs of hyperthyroidism. The correct answer is C. Take the medication in the morning on an empty stomach. Rationale for correct answer. Levothyroxine should be taken on an empty stomach in the morning to enhance absorption and maximize effectiveness. Rationale for incorrect answers. A. Take the medication with food to reduce stomach upset. Taking levothyroxine with food can decrease its absorption. B. Take the medication at bedtime to promote absorption. Levothyroxine should be taken in the morning, ideally 30 to 60 minutes before food. D. Skip the medication if experiencing any signs of hyperthyroidism. Hyperthyroid symptoms should be addressed by the healthcare provider, not by discontinuing the medication. CliniqueRN Test Day Tip. Advise patients to take thyroid medications like levothyroxine consistently at the same time each day, ideally in the morning and on an empty stomach for optimal absorption. Question 5. A nurse is caring for a patient with acute pancreatitis. The patient reports severe abdominal pain and nausea. What is the nurse's priority intervention? A. Administer analgesics as prescribed. B. Place the patient on a low-fat, bland diet. C. Encourage the patient to drink clear fluids. D. Position the patient in a semi-Fowler's position. The correct answer is A. Administer analgesics as prescribed. Rationale for correct answer. Acute pancreatitis is often associated with severe pain, and the priority is to manage the pain with prescribed analgesics to provide comfort and allow for effective interventions. Rationale for incorrect answers. B. Place the patient on a low-fat, bland diet. The patient should be NPO, nothing by mouth, initially to allow the pancreas to rest and heal. C. Encourage the patient to drink clear fluids. The patient should be kept NPO during the acute phase to avoid stimulating the pancreas. D. Position the patient in a semi-Fowler's position. Positioning can help alleviate pain, but the priority is pain management. CliniqueRN Test Day Tip. For patients with acute pancreatitis, manage pain first, as it is often severe. The patient should also be kept NPO until the acute phase resolves to prevent further stimulation of the pancreas. Question 6. A nurse is caring for a patient who is prescribed a proton pump inhibitor, PPI, for gastroesophageal reflux disease, GERD. What is the nurse's priority education for the patient? A. Take this medication with meals to improve absorption. B. Do not crush or chew the medication. Swallow it whole. C. Increase your intake of calcium-rich foods while on this medication. D. You can stop the medication once symptoms improve. The correct answer is B. Do not crush or chew the medication. Swallow it whole. Rationale for correct answer. PPIs should be taken whole to ensure proper release and effectiveness. Crushing or chewing the tablets can interfere with the medication's action. Rationale for incorrect answers. A. Take this medication with meals to improve absorption. PPIs are typically taken before meals, not with meals, to maximize their effectiveness in reducing acid production. C. Increase your intake of calcium-rich foods while on this medication. While calcium intake is important, PPIs do not directly affect calcium absorption in a significant way. D. You can stop the medication once symptoms improve. PPIs are usually prescribed for a fixed period to control GERD symptoms, and stopping them prematurely may lead to symptom recurrence. CliniqueRN Test A Tip. Ensure patients understand how to take medications like PPIs correctly to prevent complications and ensure effectiveness in treating GERD. Question 7. A nurse is caring for a patient with a history of heart failure who is receiving spironolactone. The nurse notes that the patient's potassium level is 5.8 milliequivalent/L. What is the nurse's priority action? A. Administer a potassium supplement as prescribed. B. Withhold the spironolactone and notify the healthcare provider. C. Administer an antihypertensive medication as prescribed. D. Continue to monitor the patient's vital signs. The correct answer is B. Withhold the spironolactone and notify the healthcare provider. Rationale for correct answer. Spironolactone is a potassium-sparing diuretic that can increase potassium levels. A potassium level of 5.8 milliequivalent/L is above the normal range, and the medication should be withheld to prevent complications like hyperkalemia. Rationale for incorrect answers. A. Administer a potassium supplement as prescribed. The patient's potassium level is already elevated, so potassium supplementation is not appropriate. C. Administer an antihypertensive medication as prescribed. The priority is managing the elevated potassium, not administering antihypertensives. D. Continue to monitor the patient's vital signs. Monitoring is important, but the priority is to address the elevated potassium by withholding spironolactone. CliniqueRN Test A Tip. In patients receiving potassium-sparing diuretics like spironolactone, monitor potassium levels closely. Elevated potassium levels can lead to dangerous cardiac arrhythmias. Question 8. A nurse is caring for a patient who is scheduled for surgery. The patient's preoperative lab results show a hemoglobin level of 8.0 g/dl. What is the nurse's priority action? A. Notify the healthcare provider about the low hemoglobin level. B. Prepare the patient for a blood transfusion before surgery. C. Continue with the preoperative preparation as planned. D. Administer an iron supplement as prescribed. The correct answer is A. Notify the healthcare provider about the low hemoglobin level. Rationale for correct answer. A hemoglobin level of 8.0 g/dl is low and could indicate anemia, which may affect the patient's ability to tolerate surgery. The nurse should notify the healthcare provider for further evaluation and possible interventions. Rationale for incorrect answers. B. Prepare the patient for a blood transfusion before surgery. A blood transfusion may be necessary, but this decision should be made by the healthcare provider based on further assessment. C. Continue with the preoperative preparation as planned. The patient's low hemoglobin level could complicate surgery, so the nurse must address this before proceeding. D. Administer an iron supplement as prescribed. Iron supplementation may help, but it is not a quick enough intervention to address the immediate concern of low hemoglobin before surgery. CliniqueRN Test A Tip. Always review preoperative lab results carefully. Low hemoglobin levels should be addressed before surgery to reduce the risk of complications such as poor oxygenation during the procedure. Question 9. A nurse is caring for a patient who has been prescribed levodopa/carbidopa for Parkinson's disease. The nurse notes that the patient is experiencing sudden involuntary movements. What is the nurse's priority action? A. Administer a dose of antiemetic medication. B. Assess the patient's blood pressure for signs of hypotension. C. Notify the healthcare provider about the sudden movements. D. Increase the dose of levodopa/carbidopa. The correct answer is C. Notify the healthcare provider about the sudden movements. Rationale for correct answer. Involuntary movements, dyskinesia, can occur with levodopa therapy, especially after prolonged use. The healthcare provider should be notified to evaluate the dosage and adjust the treatment plan. Rationale for incorrect answers. A. Administer a dose of antiemetic medication. Antiemetic medications do not address dyskinesia caused by levodopa. B. Assess the patient's blood pressure for signs of hypotension. While hypotension is a potential side effect of levodopa, dyskinesia requires a dosage adjustment, not just blood pressure monitoring. D. Increase the dose of levodopa/carbidopa. Increasing the dose could exacerbate dyskinesia and worsen the involuntary movements. CliniqueRN Test Day Tip. Monitor patients on levodopa for signs of dyskinesia. If involuntary movements occur, contact the healthcare provider to evaluate the need for adjustments to the treatment regimen. Question 10. A nurse is caring for a patient who is receiving intravenous morphine for postoperative pain management. The nurse notes that the patient's respiratory rate is 10 breaths per minute. What is the nurse's priority intervention? A. Administer naloxone, Narcan, immediately. B. Increase the oxygen flow rate to improve oxygenation. C. Stop the morphine infusion and notify the healthcare provider. D. Assess the patient's pain level and adjust the morphine dose. The correct answer is C. Stop the morphine infusion and notify the healthcare provider. Rationale for correct answer. A respiratory rate of 10 breaths per minute is a sign of opioid-induced respiratory depression. The morphine infusion should be stopped immediately, and the healthcare provider should be notified for further intervention, possibly including naloxone administration. Rationale for incorrect answers. A. Administer naloxone, Narcan, immediately. Naloxone may be needed, but the first priority is to stop the infusion and notify the healthcare provider. B. Increase the oxygen flow rate to improve oxygenation. Oxygen may be necessary, but it will not address the underlying issue of opioid-induced respiratory depression. D. Assess the patient's pain level and adjust the morphine dose. The patient's respiratory status is the priority, and morphine should be withheld until further evaluation. CliniqueRN Test Day Tip. Always assess respiratory rate before administering opioids. If the rate is low, less than 12 breaths per minute, withhold the medication and notify the healthcare provider immediately. Question 11. A nurse is caring for a patient who has been prescribed nitroglycerin for chest pain. The patient complains of a headache after the first dose. What should the nurse do? A. Continue the nitroglycerin and provide pain relief for the headache. B. Decrease the dose of nitroglycerin and monitor for further symptoms. C. Hold the nitroglycerin and notify the healthcare provider. D. Administer an antihypertensive medication to reduce the headache. The correct answer is A. Continue the nitroglycerin and provide pain relief for the headache. Rationale for correct answer. Headache is a common side effect of nitroglycerin due to vasodilation. The nurse can provide pain relief for the headache, but should continue the medication as prescribed unless the headache is severe. Rationale for incorrect answers. B. Decrease the dose of nitroglycerin and monitor for further symptoms. The dose should not be decreased without consulting the healthcare provider. C. Hold the nitroglycerin and notify the healthcare provider. If the headache is mild, withholding nitroglycerin is unnecessary. D. Administer an antihypertensive medication to reduce the headache. Antihypertensives are not indicated for managing headaches caused by nitroglycerin. CliniqueRN Test Day Tip. Monitor for common side effects of medications like nitroglycerin. If the side effects are mild, provide symptom relief and continue the prescribed treatment unless otherwise directed by the healthcare provider. A nurse is caring for a patient who is receiving continuous 4 infusion of potassium chloride. The nurse notices that the infusion site is swollen and warm to the touch. What is the nurse's priority action? A. Continue the infusion at the current rate. B. Discontinue the infusion and remove the 4 catheter. C. Apply a cold compress to the site to reduce swelling. D. Increase the foreflow rate to flush the line. The correct answer is B. Discontinue the infusion and remove the forecatheter. Rationale for correct answer. Swelling and warmth at the infusion site could indicate infiltration or phlebitis. The first step is to stop the infusion and remove the forecatheter to prevent further tissue damage. Rationale for incorrect answers. A. Continue the infusion at the current rate. Continuing the infusion could worsen the infiltration or phlebitis. C. Apply a cold compress to the site to reduce swelling. A cold compress may not address the underlying cause. The infusion should be stopped first. D. Increase the foreflow rate to flush the line. Increasing the flow rate could exacerbate the complication. CliniqueRN Test A tip. Always monitor for signs of infiltration or phlebitis when administering for potassium. If complications arise, immediately discontinue the infusion and notify the healthcare provider. Question 13. A nurse is caring for a patient with a history of stroke who has developed left-sided weakness. The patient's goal is to improve their mobility. What is the nurse's best approach to help the patient achieve this goal? A. Encourage the patient to perform exercises that involve the right side only. B. Assist the patient with passive range of motion exercises for the affected side. C. Encourage the patient to focus only on strengthening the unaffected side. D. Provide the patient with a walker and encourage ambulation independently. The correct answer is B. Assist the patient with passive range of motion exercises for the affected side. Rationale for correct answer. Passive range of motion exercises help maintain joint mobility, prevent contractures, and promote circulation in the affected side. Rationale for incorrect answers. A. Encourage the patient to perform exercises that involve the right side only. Focus on the affected side is needed to prevent muscle atrophy and improve function. C. Encourage the patient to focus only on strengthening the unaffected side. Both sides of the body need to be addressed to improve overall mobility and strength. D. Provide the patient with a walker and encourage ambulation independently. Independent ambulation may not be appropriate initially due to weakness and the need for support. CliniqueRN Test A tip. In stroke recovery, prioritize exercises and interventions that promote functional use of the affected side to improve mobility and independence over time. Question 14. A nurse is caring for a patient receiving total parenteral nutrition, TPN, through a central venous catheter. The nurse notes that the patient is experiencing fever and chills. What is the nurse's priority action? A. Increase the infusion rate to ensure adequate nutrition. B. Discontinue the TPN and notify the healthcare provider. C. Flush the catheter with saline to maintain patency. D. Administer an antipyretic medication as prescribed. The correct answer is B. Discontinue the TPN and notify the healthcare provider. Rationale for correct answer. Fever and chills may indicate a bloodstream infection related to the central venous catheter or the TPN. The priority is to stop the infusion, prevent further complications, and notify the healthcare provider for evaluation. Rationale for incorrect answers. A. Increase the infusion rate to ensure adequate nutrition. Increasing the infusion rate could worsen the infection. C. Flush the catheter with saline to maintain patency. Flushing the catheter may spread the infection. The TPN should be stopped first. D. Administer an antipyretic medication as prescribed. Administering antipyretics may be helpful for symptom relief, but the infection should be addressed by discontinuing the TPN. CliniqueRN Test A tip. When a patient with a central line experiences fever and chills, consider a possible infection and take appropriate measures, including stopping the infusion and notifying the healthcare provider immediately. Question 15. A nurse is caring for a patient who is prescribed metronidazole for a bacterial infection. The patient asks about the possible side effects of the medication. What is the nurse's priority teaching point? A. You may experience a metallic taste and dark urine while taking this medication. B. You should avoid taking this medication with dairy products. C. You may experience diarrhea, and you should take a probiotic to prevent it. D. You should avoid alcohol while taking this medication. The correct answer is D. You should avoid alcohol while taking this medication. Rationale for correct answer. Metronidazole can cause a disulfiram-like reaction when taken with alcohol, leading to nausea, vomiting, and other symptoms. Rationale for incorrect answers. A. You may experience a metallic taste and dark urine while taking this medication. A metallic taste is common, but dark urine is typically not a concern unless the dose is very high. B. You should avoid taking this medication with dairy products. Dairy products do not affect the absorption of metronidazole. C. You may experience diarrhea, and you should take a probiotic to prevent it. Diarrhea can occur, but probiotics should not be a primary focus of education for this medication. CliniqueRN Test Day Tip. Always educate patients on the potential interactions between antibiotics like metronidazole and alcohol to prevent serious reactions during treatment. Question 16. A nurse is caring for a patient with a history of asthma who is prescribed inhaled corticosteroids. What is the nurse's priority teaching point for the patient? A. Rinse your mouth with water after using the inhaler to prevent oral thrush. B. Use the inhaler only during asthma attacks for quick relief. C. Inhaled corticosteroids may cause your heart rate to increase. D. Inhaled corticosteroids should be used only for short-term therapy. The correct answer is A. Rinse your mouth with water after using the inhaler to prevent oral thrush. Rationale for correct answer. Inhaled corticosteroids can increase the risk of oral candidiasis, thrush, and rinsing the mouth after use helps prevent this complication. Rationale for incorrect answers. B. Use the inhaler only during asthma attacks for quick relief. Inhaled corticosteroids are used for long-term control, not as quick relief medications. C. Inhaled corticosteroids may cause your heart rate to increase. This is not a common side effect of inhaled corticosteroids. D. Inhaled corticosteroids should be used only for short-term therapy. Inhaled corticosteroids are typically used for long-term control, not short-term therapy. CliniqueRN Test Day Tip. When teaching patients about inhaled corticosteroids, emphasize the importance of oral hygiene and rinsing the mouth to prevent fungal infections. Question 17. A nurse is caring for a patient receiving IV fluids for dehydration. The nurse notes that the patient's urine output is significantly reduced and the skin appears turgid. What is the nurse's priority action? A. Increase the IV fluid infusion rate. B. Assess the patient's blood pressure and heart rate. C. Administer diuretics to promote urine output. D. Notify the healthcare provider about the change in condition. The correct answer is B. Assess the patient's blood pressure and heart rate. Rationale for correct answer. Decreased urine output and turgid skin can indicate fluid retention or inadequate renal perfusion. The nurse should assess vital signs, particularly blood pressure and heart rate, to evaluate for signs of fluid overload or poor perfusion. Rationale for incorrect answers. A. Increase the IV fluid infusion rate. Increasing the fluid rate could worsen fluid overload if the problem is related to kidney function or inadequate perfusion. C. Administer diuretics to promote urine output. Diuretics may be necessary, but first, the cause of reduced urine output must be assessed. D. Notify the healthcare provider about the change in condition. While this may be necessary, the priority is assessing the patient's vital signs and fluid status. CliniqueRN Test Day Tip. Always assess vital signs when there are changes in fluid status. This can help determine whether the patient is experiencing fluid overload, dehydration, or kidney dysfunction. Question 18. A nurse is caring for a patient with a history of myocardial infarction, MI, who is prescribed aspirin. The nurse should educate the patient to report which of the following symptoms? A. Chest pain or discomfort. B. Tinnitus or hearing loss. C. Diarrhea or abdominal cramping. D. Bruising or bleeding. The correct answer is D. Bruising or bleeding. Rationale for correct answer. Aspirin is an anticoagulant, and patients should report any unusual bruising or bleeding, as it increases the risk of hemorrhage. Rationale for incorrect answers. A. Chest pain or discomfort. Chest pain should be reported immediately, but it is not a typical side effect of aspirin therapy. B. Tinnitus or hearing loss. Tinnitus is a potential side effect of high-dose aspirin, but is not a common side effect for most patients. C. Diarrhea or abdominal cramping. Diarrhea or cramping may occur with aspirin, but is not as concerning as signs of bleeding. CliniqueRN Test Day Tip. Educate patients on anticoagulant therapy about signs of bleeding. Prompt reporting of unusual bruising or bleeding is essential for patient safety. Question 19. A nurse is caring for a patient with a history of alcohol use disorder who is admitted for detoxification. The nurse should be alert for which of the following signs of alcohol withdrawal? A. Bradycardia, hypotension, and confusion. B. Tremors, agitation, and hypertension. C. Delirium, bradycardia, and diaphoresis. D. Hypertension, fever, and shallow breathing. The correct answer is B. Tremors, agitation, and hypertension. Rationale for correct answer. Alcohol withdrawal can cause tremors, agitation, and elevated blood pressure, which are signs of withdrawal syndrome. Rationale for incorrect answers. A. Bradycardia, hypotension, and confusion. These symptoms are more likely to be seen in a patient with delirium or other conditions, not alcohol withdrawal. C. Delirium, bradycardia, and diaphoresis. Delirium may occur in severe withdrawal, but bradycardia is not a common sign of alcohol withdrawal. D. Hypertension, fever, and shallow breathing. Fever is not typical for alcohol withdrawal, but may indicate another infection or complication. CliniqueRN Test Day Tip. Recognize the signs of alcohol withdrawal early, as this condition can be life-threatening. Monitor vital signs closely and administer appropriate interventions as prescribed. Question 20. A nurse is caring for a patient receiving intravenous vancomycin. The patient reports feeling flushed and develops a rash on the upper body. What is the nurse's priority action? A. Continue the infusion at the same rate. B. Slow the infusion rate and monitor the patient closely. C. Discontinue the infusion and administer an antihistamine. D. Administer an analgesic to relieve discomfort. The correct answer is B. Slow the infusion rate and monitor the patient closely. Rationale for correct answer. Flushing and rash may indicate a mild allergic reaction or red man syndrome, which can occur with vancomycin. Slowing the infusion helps reduce the risk of a severe reaction. Rationale for incorrect answers. A. Continue the infusion at the same rate. Continuing the infusion at the same rate could worsen the symptoms. C. Discontinue the infusion and administer an antihistamine. Discontinuation may be necessary if symptoms worsen, but the first step is to slow the infusion and monitor the patient. D. Administer an analgesic to relieve discomfort. Analgesics may help with discomfort, but the priority is to manage the infusion and monitor the patient. CliniqueRN Test Day Tip. Monitor for signs of allergic reactions or infusion-related reactions when administering antibiotics like vancomycin. Slowing the infusion rate can help prevent complications such as red man syndrome. Great job! Click the YouTube link card above to join our NCLEX Questions Challenge. And don't forget to sign up at CliniqueRN.com for even more practice. Check the description for more links. Like, subscribe, and stay tuned. See you next time.